Hi everyone, I am Beverly Jane L. Datu, Block C, third year student nurse from NUSD, and today I will be discussing the brief main points about GCS, or also known as the Glasgow Coma scale, and how it is assessed to other patients. So let's ahead for the definition itself. For the definition, a Glasgow Coma scale, or GCS, is the most widely used scoring system that determines the level of consciousness of an individual with a suspected or confirmed brain injury. The GCS was initially used to assess level of consciousness after head injury, and the scale is now used by first aid, EMS, nurses, and doctors as being applicable to all acute medical and trauma patients. In hospital, it is also used in monitoring chronic patients in an intensive care unit. For the purpose, this scale is not only used after traumatic head or brain injury, but it is also utilized in first aid, emergency medical services, acute cases, and for the monitoring of chronic patients in intensive care units. This scale is used to Number 1, address the 3 areas of neurological functioning. Number 2, gives an overview of the patient's level of consciousness. And last, number 3, evaluates the neurologic status of patients who have had a head or brain injury. A little fact about GCS is the scale was published in 1974 by Graham Tisdale and Brian J. Jennett, both professors of neurosurgery at the University of Glasgow's Institution of Neurological Sciences at the Cities of Southern General Hospital. What is assessed or measured in GCS? The use of Glasgow Coma scale does not take place an in-depth neurologic assessment, but rather it provides an evaluation of the patient's responses in the following areas, such as eye-opening responses, verbal responses, and monitor responses. The 3 areas are further divided into different levels where a number is assigned to each of the possible responses within the categories. A high number means that the response is normal, while a low number denotes an impairment of the neurologic function. The calculated total figure indicates the severity of the coma of a patient is experiencing. The lowest score is 3, at least responsive, suggests or reflect that the patient is in deep coma, while the highest score of 15, most responsive, means that the patient is fully intact. For this slide, we are about to proceed in GCS, or Glasgow Coma Scale table. The table consists of 3 areas of GCS. Let's start with the eye-opening response. It involves the evaluation of arousal or being aware of the environment. Score number 4 is classified as spontaneous. The eyes were opened spontaneously. Score number 3 is classified as to speech. The eyes were open to speech. Score number 2 is classified as to pain. The eyes were open in response to pain only. For example, trapezium squeeze, caution if applying a painful stimulus. Score number 1 is classified as no response. Both eyes were not open to verbal or painful stimuli. For verbal response, it involves evaluating of awareness. Score number 5 is classified as oriented. The patient responds so coherently and appropriate to questions such as the patient's name, age, and where they are, and why, the year, month, and etc. Score number 4 is classified as confused. The patient responds to question coherently, but there is some disorientation and confusion. Score number 3 is classified as inappropriate words. Random or exclamatory articulate speech but no conversational exchange. Score number 2 is classified as incomprehensible sounds such as moaning but no words. Score number 1 is classified as no response. No verbal response, it means no communication. And last, for motor response. It is designed to determine the patient's ability to obey a command and to localize and withdraw or assume abnormal body positions in response to painful stimulus. Score number 6 is classified as obeys command. The patient does simple things as ask. Score number 5 is classified as moves to localize pain. Purposeful movements towards painful stimuli. Example, hand crosses midline and gets above clavicle when supraorbital pressure applied. Score number 4 is classified as flex to withdraw from pain. It means flexion of elbows, supination of forearms, flexion of wrists when supraorbital pressure is applied. Pulls apart the body away when nail bed pinch. Score number 3 is classified as abnormal flexion, decorticate posture. Flexor posturing, abduction of arm, internal rotation of shoulder, pronation of forearms, flexion of wrist, decorticate response. For score number 2 is classified as the abnormal extension, decelerate posture. Extension of posturing, abduction of arm, external rotation of shoulders, supination of forearm, extension of wrist, decelerate responses. And for score number 1 is classified as no response. It means no motor response. Each individual categories or elements as well as the sum of the score are important. For example, the score is expressed in the form of a client who is most responsive. GCS 15 is equal to eye-opening response of 4, verbal response of 5, motor response of 6 at 4:30 p.m. This means that the client's GCS total score is 15, where the eye-opening score is 4, motor response of 6, and verbal response of 5 as of the 4:30 in the afternoon. Coma is suspected if the GCS score is equal or less than 7. A score that is equal to 8 or less could also just suggest a severe brain injury. GCS 9 to 12 indicates a moderate brain injury and more than 3 denotes minor brain injury. Coma with use of GCS is defined as not opening eyes, not obeying commands, and no verbal response. And last, for the procedure. Explain the procedure to the patient. Ascertain the patient's acuity of hearing. Ideally, use an interpreter if the patient does not speak English. Check the patient's note for any medical condition that may affect the accuracy of the GCS or, for example, previous stroke affecting the movement of the patient's arm. Then last, check the neurological observation chart for the GCS scale. And that's how I end my presentation for today. Thank you for listening, and I hope you have learned something from me. This is Beverly Jane Datu, a third-year student nurse from NAUST, and this is how I discuss my GCS presentation. In the next slide, you will also see every site that I use in this presentation.